In this video, I'll tell you all of the surgical secrets that go into creating a natural hairline. Some things might surprise you, but to recreate nature, we must first try to understand it. So let's go over the features of a natural hairline and then how we can surgically try to recreate it. The first feature of a natural hairline is that it has both shape and is at the same time shapeless.
I said empty your mind. Be formless, shapeless, like water.
I know it sounds like a contradiction, but I'll tell you exactly what that means. The hairline is normally ordered into a basic shape, but when you look close and you zoom in, you start to see disorder or irregularity. The irregularity is both microscopic and macroscopic. The second feature of a natural hairline is that it has general directionality. It's similar to driving on major roadways, where the direction usually flows in predictable ways, and changes occur more gradually, not abruptly. There is, of course, the most common types of directions, but some people have more unusual patterns. The central hairline generally flows anteriorly, whereas the temple flows inferiorly. But for some, the direction can be all posterior or partly posterior and partly anterior. The third feature of a natural hairline is that there's specific angulation that changes throughout the hairline. Like the exit angle of a ball in baseball, the hair shafts exit the scalp at various angles. Typically, the frontal hairs have a more acute exit angle than the hairs further back. The most acute angles are seen in the temple area, which is what contributes to the challenge of recreating it. The fourth feature of a natural hairline is that the density of the hair also changes throughout the hairline. The hairline is usually quite dense, and that helps reduce the light penetration when viewed from the front. And density reduces as we age, especially in the temple area. The fifth feature of a natural hairline is that there are finer hairs in the front. These finer hairs, sometimes called sentinel hairs or single hair grafts, are usually in the first 2 rows of the hairline. And as you move further back, you start to see 2, 3, and 4 hair grafts. That fade of graft size reduces the harshness of the hairline. Now let's go over how we surgically recreate these natural features. The first is that you have to decide where to place the hairline. For this, we take into consideration the age of the patient. Younger patients are usually looking for a more youthful type of hairline, and as we get older, we are more willing usually to conform to a more conservative hairline, and that will guide in part where we decide to place the hairline. We talk a lot about that in other videos, so make sure to subscribe and check out our other hair related videos. We also need to take into account the current hair loss and the potential for further hair loss in the future. And medical therapy is very important for preserving your existing hair. I always say this, that surgery is about bringing in a fresh supply that you want to use to build on a solid foundation. That foundation is helped by medical therapy. To learn more about medical therapy and to obtain some of the medications, please check out feelconfident.com. For placing the hairline, we also need to know how much donor supply do we have. The more donor there is, the more possible it is to potentially slightly lower the hairline or to have something that reflects a more youthful hairline. The less donor supply there is, the more conservative we have to be, and the further up we need to push the hairline so we can still build out something that looks nice. For placing the hairline, it's good to have a sense of the horizontal thirds of the face, because sometimes when there's no hairline at all to begin with, it's a question of where do we place it. We can place it anywhere along the forehead onto the scalp. So one way to look at it is measuring the horizontal thirds of the face, and they should be roughly equal, but oftentimes it's okay for the upper third to have a little bit more height than the middle and lower thirds of the face. Another way to decide where to place the hairline is to assess the horizontal plane that's coming off of the scalp and the vertical plane that's coming up from the face, and seeing where those two meet and where they triangulate. And roughly in that zone is where the hairline should be. But we don't want to place the hairline too low for men. We need to take future hair loss into consideration when planning the hairline. We have a whole video about this please check it out. And the second factor in surgically recreating a hairline is deciding on hairline shape. Now, this is where you need to consider the gender of the person, because a male hairline will have some more recession in the frontotemporal areas, whereas a woman will have a more blunted frontotemporal area that will be more curved and less pronounced in the degree of recession. It's also important to consider ethnicity and personal preferences. Now, one question that comes up is, should we recreate the temple loss? So oftentimes people have a recession of the temple area, and question is, should we try to build that up again? Well, that depends on how much donor hair there is. If there's enough donor supply, then we'll consider doing it. It'll usually take at least 500 grafts to bilaterally recreate the temples. So we need to have that extra supply. It also depends on the person's goals, and it depends on the size of the recipient area and how many grafts we're working with in a single session. If we have a very large recipient area, we might consider not doing the temples because the density that we'll create in the temples won't be enough for an appreciable change. So many elements go into deciding if it's worth building up the temples or not. One of the advantages of doing temple work is that it really helps with reframing the face, so the forehead doesn't look as broad. And lastly, we want to check for symmetry. One thing that I found has helped in figuring out symmetry after placing the markings on someone's head is to actually take a picture of the area and assess it in the photo. Sometimes you see it differently in the photo than you do with just looking at it with the naked eye. I also find it helpful to get my staff involved, and of course the patient is actively involved in the process of figuring out shape, symmetry, and where the hairline is placed before proceeding to the actual surgery. The third way that we recreate natural hairlines is to build in irregularity. One way to ensure regularity is to use dots instead of those thick marker lines at the hairline, so that you're essentially forced to create that irregularity in between those dots as you work. My other technique is to use small vertical drop down lines randomly placed along the hairline, and that will lead to the illusion of macro irregularity. So again, we have to create macro and micro irregularity, and we want to create a shape without the appearance of an exact line. We don't want it to look fake. When it comes to micro irregularity, my technique is to use a diamond shape approach. So what I do is I basically have about 4 sites that I make at a time in a diamond shape that I focus on one unit at a time, and that allows for some built-in micro irregularity. The fourth way that we surgically recreate natural hairlines is to map out the direction of the hair in the vicinity and to study the angles of the hairs that are nearby where we're about to work. So using surrounding hairs as guidance, I like to take a marker and actually draw on the scalp the direction of the hairs. Now, sometimes the hairline has no nearby hairs and you're just working on a bare zone. In this case, you observe the closest hairs to the area and you essentially transpose the direction onto the bare area. You need to be careful not to abruptly change the directionality. And if you need to change direction, you have to do so gradually. I always observe for cowlicks and try to follow them whenever possible to again maintain that naturality. The fifth way that we surgically recreate hairlines is to start with the sites for the single hair grafts. Using the initial markings, the frontalmost hairline is created first. This usually includes the first 2 to 3 rows of hair. Small sites are used for the hairline to both create density and to also keep the technicians from placing heavy grafts right at the hairline. You need to follow the angle and direction closely. This is critical. I use custom cut blades with a blade holder for maximum control. And I adjust the patient's chair and my chair continuously as I work to get the proper angles. Keep in mind that the harvest might not yield enough single hair grafts for the hairline. So the team needs to be proficient at splitting the hairs under the microscope. which is a difficult skill. And at the end of the case, I like to do some fine tuning where you start to really see the density even better once the grafts are placed into the sites, and you can go in between and try to increase the density safely throughout the hairline. Also, we can add in additional irregularity towards the end of the procedure if needed. And the final step for recreating a natural hairline is to complete the sites for the larger grafts. You need to keep it tight. You want to reduce the gap between the single hair grafts and the multiples just behind it. And you usually need good density for at least a few centimeters from the hairline edge in order to reduce that light penetration. It's important to follow a staggered pattern so you don't have lines of grafts, because that will look unnatural. And one of the most critical areas for giving the illusion of good hair and density is to really focus on the frontal tuft. That's this area right here in the center. Getting that density up is important, but the tricky thing is that the blood supply of that area can sometimes be weaker than in other locations. And because of that, you need to be careful to not overburden the area with too many grafts, because then you could have survival issues. As I always say, surgical density is not the original density. There's always this balance between not having enough density and having too much density, where you could compromise graft survival and risk things like skin necrosis. And anyone going into a hair transplant needs to realize that a second procedure to increase density might be necessary. Some people ask, well, why can't you create original density with a single hair transplant into a bare area? And the reason is this: when you do the actual surgery and you create recipient sites, you need to keep some healthy skin in between your sites. You need to keep the sites distinct. You can't have just like one large site, because then when you go to place a graft, it's going to float around in that site. It will lose its angulation and directionality that's dictated by the site. So in order to have these distinct sites, you leave some healthy skin in between. Also, that's good for blood supply to the grafts. As you leave those healthy areas of skin, normally they're occupied by hair. So instead of that healthy little small island of skin, you will have had in your original hairline a hair coming out of it. So that's why when the grafts eventually grow out, you'll be missing some of that original density. And in order to improve on that, you need to go back in once you have hair now, where those original islands were that you left behind when you made the sites, and now create sites into those islands of healthy skin and put hair there. And that will allow you to reach closer to your original density. Now, here are some other surgical considerations that go into creating a natural hairline. It's important to clean the scalp. We usually use betadine to clean it well. In terms of numbing, we try to keep patients comfortable. So sometimes that's the speed of injection. Slowing down the speed of injection can make receiving those numbing shots much more comfortable. Also, using less volume at a time will also make numbing shots more comfortable. The depth of recipient site creation is very important. If you create sites that are too deep, then your grafts have the potential of sinking in, and you can get something called pitting. If your sites are not deep enough, your grafts will then stand up out of the skin potentially too much, and they might not take and they may not survive and grow. The size of the sites is very important. You don't want site sizes that are too big, because then the grafts will be floating around, and again, you'll lose that angle and direction control. You also don't want sites that are too small, because when you put your graft in, it's going to potentially strangulate the graft and it may not survive. It needs to be just right. The use of PRP intraoperatively can also be great for both protecting the surrounding hairs from shock loss and improving regrowth of the newly transplanted hair. ATP used intraoperatively to serve as part of the solution that your grafts are swimming in and bathing in during the surgery can be helpful for keeping them energized and viable throughout the surgery. And also the tumescent solution that is used, which is part of the numbing process, can sometimes contain Kenalog, which is a steroid that we find is helpful for reducing inflammation and and swelling post-operatively. Your decision making on where to go to get a hair transplant shouldn't be solely based on going to one country or another. It should be based on finding a surgeon and an artist who understands the fundamentals of hairline design and who can recreate it naturally for you. Since you enjoyed this video, check out our video on post-operative care after a hair transplant.